Linzess, linaclotide, is a prescription medication used in adults to treat irritable bowel syndrome with constipation, IBS-C, and chronic idiopathic constipation, CIC. Idiopathic means the cause of the constipation is unknown. It is not known if Linzess is safe and effective in children. Important risk information. Do not give Linzess to children who are under 6 years of age. It may harm them. You should not give Linzess to children 6 to 17 years of age. It may harm them. Do not take Linzess if a doctor has told you that you have a bowel blockage, intestinal obstruction. Please see additional important risk information at the end of this video.
Linzess is a once-daily capsule that helps adults proactively manage their symptoms of irritable bowel syndrome with constipation and chronic idiopathic constipation. Only Linzess is approved to treat both men and women with IBS-C or CIC. Linzess is not a laxative. Linzess works differently from other available medications. It acts locally in the intestine, and based on non-clinical studies, it is thought to work in 2 ways: by decreasing the activity of pain-sensing nerves in the intestine and by accelerating transit in the intestine. I tell my patients to take 1 capsule of the medication on an empty stomach 30 minutes before their first meal of the day. If you have IBS-C, Linzess may help you to reduce abdominal pain or discomfort and help with constipation, causing you to have more frequent and complete bowel movements that are easier to pass. You may have an improvement in your constipation in 1 week, though it may take longer to feel improvement in your abdominal pain. If you have CIC, Linzess may help you have softer, more frequent, and complete bowel movements. You may have improvement in your constipation symptoms within 1 week. If you stop taking Linzess, it is possible that your symptoms could return in about 1 week. Whenever I prescribe Linzess, I make sure that my patients understand the possible side effects they may experience. The most common side effect of Linzess is diarrhea, which can at times be severe. It usually occurs in the first 2 weeks of treatment. If you experience severe diarrhea, it's important to stop the medication and call your doctor right away. Other common side effects of Linzess include gas, pain in your stomach area, swelling, or a feeling of fullness or pressure in your abdomen, which is also called distension. It's really important to tell your doctor if you experience any side effect that bothers you or that doesn't go away, so that he or she can work with you to address the side effect. For my patients with irritable bowel syndrome with constipation and chronic idiopathic constipation who are treated with Linzess, I typically see improvement in their bowel symptoms in 1 week. If they have any side effects, I work with them to manage them. It is very important that patients are open and honest with their healthcare team about their symptoms, about how they feel, and about side effects from treatments. We need a complete picture of how IBS-C or CIC symptoms are affecting you in order to determine the best treatment possible. Linzess is an option that has worked for many of my adult patients with IBS-C or CIC, and you and your doctor can determine if Linzess is the right medication for you.
Important risk information. Do not give Linzess to children who are under 6 years of age. It may harm them. You should not give Linzess to children 6 to 17 years of age. It may harm them. Do not take Linzess if a doctor has told you that you have a bowel blockage, intestinal obstruction. Before you take Linzess, tell your doctor if you have any other medical conditions. If you are pregnant or plan to become pregnant, it is not known if Linzess will harm your unborn baby. If you are breastfeeding or plan to breastfeed, it is not known if Linzess passes into your breast milk. About all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal supplements. Side effects. Linzess can cause serious side effects, including diarrhea, the most common side effect, which can sometimes be severe. Diarrhea often begins within the first 2 weeks of Linzess treatment. Stop taking Linzess and call your doctor right away if you get severe diarrhea during treatment with Linzess. Other common side effects of Linzess include gas, stomach area, abdominal pain, swelling, or a feeling of fullness or pressure in your abdomen, distension. Tell your doctor if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of Linzess. For more information, ask your doctor or pharmacist. In addition, call your doctor or go to the nearest hospital emergency room right away if you develop unusual or severe stomach area, abdominal pain, especially if you also have bright red bloody stools or black stools that look like tar. How to take Linzess. Take Linzess exactly as your doctor tells you to take it. Take Linzess one time each day on an empty stomach, at least 30 minutes before your first meal of the day. Swallow Linzess capsules whole. Do not break or chew the capsules. If you miss a dose, skip the missed dose. Just take the next dose at your regular time. Do not take 2 doses at the same time. Storing Linzess. Store Linzess at room temperature, 68 degrees Fahrenheit to 77 degrees Fahrenheit. It is important to keep Linzess in the bottle it comes in. Keep the Linzess bottle tightly closed in a dry place, and keep the desiccant, the drying agent, in the bottle. Keep Linzess out of the reach of children. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/MedWatch or call 1-800-FDA-1088. Please also see the medication guide within full prescribing information at www.linzess.com. Ask your doctor about Linzess. For more information, call 1-800-LINZESS.